Hi, I'm Dr. Charlie Galanis, board-certified plastic surgeon in Beverly Hills, California.
Today we're talking about saline versus silicone implants. Before I get into a discussion about some of the differences, let's first define exactly what we're talking about. Both saline and silicone implants have a silicone polymer exterior shell. The difference is what's inside the implant. With silicone implants, the interior is a silicone gel, which is designed to look and feel and move like natural human tissue. In the case of saline implants, the interior is saline, or salt water. With this understanding, let's move to a discussion of some of the pros and cons, and I'll break it down by categories. First up is safety. From all scientific data that we have to date, both saline and silicone implants have been found to be safe devices to be placed in the human body, and in fact, satisfaction rates with both implants is greater than 90%. So in this category, both get a pass. Next up is the look. As mentioned previously, silicone implants have a 5th generation silicone gel which is designed to feel and move like natural human tissue. For this reason, it can confer more of a natural teardrop shape than its saline counterpart. Furthermore, silicone has a lower incidence of rippling than does the saline implant. Next up is the feel. Silicone implants with their 5th generation gel tend to mimic natural tissue better than saline implants. For this reason, most patients prefer silicone implants for the natural feel over their saline counterparts. Next, incision. Silicone implants can be placed typically through an incision that measures between 3 and 4 centimeters. By contrast, saline implants are generally placed empty and filled once inside the body. Therefore, they can be placed through a slightly smaller incision. In the end, patients may have about a centimeter less of scar with a saline implant versus a silicone implant. What happens when these implants rupture? First, it's important to note that in either case, the rupture does not mean a medical emergency. In both cases, it's safe and the patient can take care of it when their opportunity presents itself. That being said, when saline implants rupture, there is an immediate deflation of the breast and asymmetry can be quite obvious. Patients may also feel fluid moving around when it has been released from the implant itself. In contrast, silicone implants have what's called a silent rupture. The gel tends to maintain its shape and size so that even in cases of rupture, the breast will look exactly the same. In fact, there's only one way to tell when a silicone implant ruptures for sure, and that's with an MRI study. Next, let's talk about cost. Saline implants are slightly cheaper than their silicone counterparts, and that may be something that patients might want to consider. That being said, the difference may be pretty small and not necessarily a deciding factor for the patient. In about 90% of cosmetic cases and 100% of reconstructive cases, silicone implants are the preferred implant. I think this is largely due to the superior feel and look that patients get with those implants versus the saline implants. Nonetheless, this is a discussion you should have with your provider.